What's Connor talking about?
Close the bathroom door. No, I like the bathroom door open. I like that. That's my quiet place. Oh God.
Did you just
Dude,
say
I
he
gotta
likes the
eat
bathroom
something.
door
What should I
open?
eat for dinner? I don't even know. Let me text. I don't know what Lod's doing right now. I'm doing the yard later, so I gotta text. What you doing?
Ew.
Food, boss.
I cannot use the bathroom with the door open. Are you f***ing crazy?
I've got a lot of messages since I gone live. What the fuck? Yeah, when the pokey stuff started going crazy on Twitter, I started getting a lot of messages. People being like, hey, I would love to give an item, which is, I'm very grateful for. But I was kind of overwhelmed a little bit.
Aww.
When is Soak for
Okay.
Hope happening? Gotta ask Chris about that. I'm still down to Soak for Hope, though.
Oh, soak for
I'm still
hope.
down to Soak for Hope.
I mean, I live alone. I get it. Even if I did live alone, I would not have the bathroom door open. I wouldn't. I just can't use the bathroom while it's open. Are you crazy? You got me up. You gotta be kidding me. Ain't no way. Ain't no way I'm gonna use the bathroom with the door open. Are you crazy? I don't even care. I don't care if I'm peeing. That's private. It's private time for me. Even if there's nobody there. Pervert, stop looking at it. What does he say now? Can you imagine if I unmute and then he's talking about the bathroom again?
He's donating her own play button, which she's allowed to do.
Okay, never mind. It's not about the bathroom.
Which is very funny. Classic Ludwig. Hey, Cdo, I have vasculitis GPA, which is an autoimmune disease. Thanks for supporting this charity. Hopefully make my life a bit better. I will be honest, because a lot of people do mix this up. Primary immune deficiency and common variable immune deficiency is the opposite of autoimmune diseases.
Oh my God, he learned!
Autoimmune system, from my understanding, what Mouse explained to me, autoimmune is where your immune system is attacking itself, and primary immune deficiency is where your immune system just doesn't work. You just don't have one. Or I think you have too much.
He
right? You have too much. But listen, here's how I feel. And I'm not an expert on this, right?
I'm so proud of him.
I feel like
let's go.
all of this
I'm so
stuff
proud of him.
is not very well known. So having any kind of, exposure to any of this and awareness raised
I'm so proud.
is good. Regardless of if it's this one or
He
that one. I think also
learned!
just getting people to know about this stuff is helpful. Even though it is slightly different. And people do mix that up a lot. As Mouse told me,
It's
Mouse
true.
told me off when I said autoimmune. Because I said autoimmune one time. Because I heard that a bunch. But listen, I think it helps.
I did tell him off.
Plasma donations equals autoimmune treatments anyway. If that's true, big, huge. Again,
They do
that's
use
a
it
part of
for
the show that I
some,
wanna
but it's
encourage people
not
to donate plasma, and
for
hopefully
all
Mouse
of
will talk
them.
about that as well. Now it's time for a let's
They
pet
do
food
use
spray.
they do use plasma donations. Plasma's used for a lot of things. They have also started using plasma for things like Alzheimer's and a lot of other conditions that are not just primary immune deficiency related. It's true. I'm not well versed in that because listen, I don't have autoimmune disease. I do not have an autoimmune disease. I don't know shit about autoimmune diseases, okay? I only know anything about primary immune deficiency diseases. That's the only thing that I know. I don't know anything else about anything else. Ugh. But thankfully, plasma's for everybody. Plasma helps for a lot of things. It's true. They use it for a lot. They used a lot of when COVID happened. So when COVID happened, they were looking for a lot of plasma donations, which is why we had a shortage because they were looking for plasma, specifically people who have beaten COVID because they needed the antibodies in order to treat people with COVID. When COVID happened, they were using plasma to treat COVID patients, which is why there was a huge plasma shortage. I don't know if you guys remember that we had a bit of a problem. We had a bit of an issue for a while with the shortage. It was pretty bad. It was pretty rough there. But, thankfully, I guess through awareness and stuff, we now have so much more people are donating plasma, and it makes me very happy. So I will say to you again today, if you can donate plasma, please donate plasma. If not, tell somebody to donate plasma. You know what I mean? Spread awareness. You get paid for it if you donate, I know not everybody can do it, and not a lot of people do it, but just the thought is good enough. You know what I mean? Just the thought is good enough. What a time. What a time. I just remember, I remember no one knowing anything about plasma. And now so many people know about plasma. And it just warms my heart that so many people know about plasma now. And that the charity is getting attention and all this stuff, and people know what PI means, people know what PID means, people know what CBID means, people know things now. And that's what's most important, that people know things, you know? And that means the world to me. Thanks to you and Connor and many others. Well, thank you very much. Yes. Thanks to me, Connor. But listen, you guys can say thank you to you and to me and Connor all you want. But it's you guys. Thanks to you guys. Because we could talk to people, but you guys are going out there in the world. You guys are going out there in the world and doing so much. And it's just so amazing to see. It's something that I wish I could do. I wish I could go out there in the world and do stuff, but I can't because I'm stuck in my house. But I'm just thank you guys. Thank you guys. Thank you guys so much. Thank you guys so much. You guys mean the world to me, and you guys have done so much for us. So much for me, so much for Connor, so much for people that are going through PID, and it's just very touching and very heartwarming. So thank you guys so much. I appreciate all of you so much. Thank you. 20% of people with common variable immune deficiency can get an autoimmune disorder. Yes, it's true. Also, when you have common variable immune deficiency disease, there is also an elevated risk of getting cancer. I think it's like 35%, I think. There's a lot of warning. There's a lot of warning stuff going out there. Thankfully, I just have my own issues. I have my own issues. I don't talk about them. The only thing I do talk about is the CVID stuff. Yep. It's pretty scary. It's a pretty scary thing. My best friend has CVID and cancer, but she's gotten over the cancer years ago. That is very wonderful to hear. I'm so glad. I'm so glad they beat cancer. Holy shit. Cancer, bro. Yeah, well, I mean, it's because our immune systems are so you know? Our immune systems are up, so we're more susceptible to getting things, not just to getting sick from like bacteria and viruses. We're more susceptible to getting shit. You know what I mean? So it really sucks. Basically, like, you're like living in constant fear like all the time that something is gonna pop up, something's gonna happen. But you know, I try not to think about it. It's one of the reasons why, like I said, I run away from my life and I do occupy my time with a million and one other things, so I don't have to think about that. I don't have to think about all that scary stuff because I don't like thinking about that scary stuff, and I don't want to talk about it, and I don't want to. I just don't, because I feel like you waste so much time of your life. You waste so much time of your life worrying about stuff like that you forget to live your own life. You know what I mean? And I feel like I've spent a lot of my life worrying about stuff, so I'm just ready to start living. You know? I'm ready to start living. And I'm tired of just worrying about all those things. I don't need to worry about all that illness stuff. I just want to be a person and be me and live my life. And then that's what I'm most concerned about. You know what I mean? And I feel like there's a lot of people that are sick that feel the same way. Connor, thank you for the raid. I hope you had a great stream. Crazy day today. I hope everything went well. Hi, everybody. We were gonna watch the panel, but I started talking about stuff. Coots raid? Oh, was Coots there? Bro, I love Coots. Coots is so cute. She's the cutest kitty ever. She's the cutest cat I've ever seen. Coots is content. She's the cutest cat I've ever seen in my life. Oh, Coots is next to him. Oh, yay! I know her little ears are so cute. Her little ears and her little eyes that they look up and they're like so sad. Coots has sad eyes and they're so cute. Coots seems like a very old soul. You know what I mean? Connor finally got the pet Coots. Yeah, let's go! Finally! Connor misgendering Coots still? Yeah, but listen, Connor's a dog person, okay? You could tell Connor's not used to being around a cat. I mean, I'm not used to being around a cat either, but I've seen many cat videos and I have many friends who are cat owners, okay? Some people are some people. Connor from Trash Taste, shaking my head. He's just a sea dog. Connor from Trash Days, shaking my head, tisk, tiska, tiska. Yeah, I was just complaining about CVID stuff. And saying, for those of you that came now, I was thanking everybody for doing everything that they do and for spreading awareness about plasma donation and spreading awareness about PID. And I was also celebrating the fact that Connor finally knows the difference between autoimmune disease and primary immune deficiency disease. Let it go! Let's go! Yeah, he learned. Let's go! I'm gonna shake my pill bottle in happiness. Woo! Shaking my pill bottle in happiness. Wait, I'll shake my other one. Wait, I'll shake my other one. I'll shake both of them at the same time. I'll shake all three of them. Wait, hold on. I'll shake my fourth one. Wah! My pills. That's a lot of pills. I wish I could tell you those are the only ones. And I wish I could tell you that I totally only take pills and not other stuff. Well, how many do you have? I don't want to say how many I take now, but I can confidently tell you that when I first started streaming, the amount was double to what I take now. Double, if not triple, to what I take now. So it's a big improvement, I just have to say. It's crazy what plasma can do, guys. It's crazy what regular plasma can do to improve your life. I take plasma every week. It has improved my life significantly. I can manage my disease way better now. I do still get sick, but it's not anywhere as close to what the was going on with me years ago. So it's the power of plasma, which is why I again will say, if you can donate plasma, please donate plasma. Oh, please donate plasma if you can, please. I would really appreciate it. But yeah, like I said, years ago, my medicine stuff was double, if not triple, than what I take now, which was pretty bad. It was pretty bad. It was a lot to manage. It was way too much to manage by myself. So for everyone, everywhere. What does plasma look like? Oh, plasma. Human plasma. I could show you. I'll show you two versions of it, okay? I'll show you two versions, okay? So first, when they take it out of your body, this is what it looks like. It looks like pee-pee, okay? It looks like pee-pee. When they take it out of your body, that's what it looks like. It looks like pee-pee. I make plasma all the time. It looks like pee-pee, okay? And then when it comes out of the body, and then they put it through processing, they do a lot of stuff, you know. They're like, oh, we're gonna turn this into medicine so that we can give it to a patient. Blue, you know? Then it looks like this. What the? Coño carajo, load! Like this. And like this. You see all those bubbles? The liquid, I'm just letting you know, the stuff that's inside of here, this is so fucking sticky. You will not believe how sticky that liquid is. It is so sticky that if it gets on anything, your clothes, your table, your floor, it is permanent, sticky, forever. It's super sticky. Yeah, maybe it's the proteins. It's very sticky. Very expensive, very sticky. Also, it gets very bubbly. So, like, if you shake that bottle, the whole thing will turn into suds. It'll turn so sudsy that it's like, that's why, like, you have to be very careful when handling the medication so that the bubbles go away, because more bubbles equals less medicine. And less medicine means more money wasted. And more money wasted means not enough liquid gold going into my body and saving my life. It gets so bubbly. It's crazy. It is crazy. Do not shake it. You mean like bubbles like when you get IV? So basically, like, bubbles can be dangerous, but only if you get a lot of bubbles. Oh, like, I'm talking, you have to get a full line of bubbles injected inside of you in order for it to do anything to you. One or two tiny little bubbles isn't gonna do to you. It's not gonna do anything. A few bubbles probably make you a little uncomfortable. You can't, you know how sometimes like in movies they're like, oh my god, I'm gonna kill you, I'm gonna put IV and air in your IV. You need like a full line of air to die from air in the IV. So don't worry about it. If you see a little bubble in your IV, don't have a panic attack. You're fine and you're gonna be fine. How many donors does it take to make one vial? Oh my god, I used to know this by heart, but I don't remember. Hold on. How many donors does it take to make one treatment of IVIG? It was an insane amount. I used to know this by heart and I don't remember. Guys, my brain is melting. I forgot the exact number, but it was an insane amount where I was just like, what the fuck? My brain is so... I used to know all this off the top of my head. Ironmouse, what's wrong with you? Ah, there you go. 130 plus... Over 130 plasma donations are used to treat one patient with PID for 1 year. 10 to 40 plasma donations to create one single dose of immunoglobulin. So you need 10 to 40 donations for one single dose. And 1,500 to 50,000 units of plasma go into a single batch. Isn't that crazy. But when I'm looking, it says that this is for sub-Q. So that's totally different than IVIG. Because sub-Q is different. Sub-Q is through skin. So they put it through your skin. Okay? So those are the numbers for sub-Q donation. These are not the same numbers for IV, for intravenous stuff. So I think it's a little different. It probably isn't, but I'm not really sure. I've never really had a sub-Q. I never qualified to get sub-Q because I was always too fucking severe to get sub-Q. And now I'm at like treatment every week. So it's like a plasma symbiote. I got that symbiote, baby. What's a common amount of doses for a CVID patient? It's hard to say because everybody is different in severity. The reason why it's called common variable immune deficiency disease is because it's although it's the most common of all the primary immune deficiency diseases, it is the most craziest in variation. So basically CVID is kind of like an umbrella term, just like PID is an umbrella term, because everybody's of different severities. Everybody's different. No one's the same. All of our doses are different. It just depends on your body chemistry. It depends on your weight. It depends on how sick you've been getting. Because if you keep getting sick when you're on treatment, they adjust your medication. They adjust how much you get, and they adjust the frequency. So I've been on plasma for a long time. And when I started plasma, I was taking it every month, but slowly my health started deteriorating to the point where I had to take it every 3 weeks, every 2 weeks, and now I'm at every week. So I'm kind of like a little bit different than most patients because most patients are still at every month, you know? But everybody varies. Everybody's different. I don't want to like put any numbers out there because I can't speak for everybody, you know? It's tough. It's tough because you know, it's basically a lot of like guessing. It's a lot of guessing when you see your doctor and your doctor's like trying to prescribe the right fit for you because you just really don't know until you try it. I do have to get it frequently for myself. Could you get to where it is less frequent? I feel like I've been told in the past no, but I feel like maybe that might be changing. I don't really know. I think I'm gonna be honest with you. I wish I could say yes, but no. Because right now, the reason why I am where I am is because I'm at this dosage, and any deviation from the way that I'm doing things now will result in me getting really, really sick. And the reason why I know this is because I've had issues where my insurance would give me issue or I couldn't get the medication because there's a shortage and I'd have to wait like 2 weeks, 3 weeks. And I have to say that after I pass the week, I usually have a little bit of a window of after a week to like a few days, like maybe 4 to 5 days. And then I start getting pretty bad. Then I start getting pretty sick. It's like a cycle. It's like a cycle. It's a cycle to the point where it's like I'm on rotating antibiotics because I get sick so frequently that I have to rotate out and do a bunch of other stuff too because yeah, it's pretty bad sometimes. It's just a constant cycle. It's just a constant cycle of me trying to stay at a level where it's like I can function as a human, but a normal human would not be able to function in this way, but for me, I can, I think. Bro, don't get me started on insurance, please, please, please. Everything is like authorization for this, authorization for that. We need authorization for this, and we need authorization for that. And most insurances, they require for you to be on like a step program. So for those of you that don't know, a step program is basically the insurance company says, oh, you're sick, but we feel like you don't need this medication because this medication is for people that are like really, really sick. And we don't think you're that sick. So we want you to try this first. And then if it gets bad, then you try this. And then you try this. And then we'll put you on the other one. But you need to show proof that you're trying these things. And then it's like, what the fuck? Bro, I'm telling you, it's so fucked up and so stupid. It's to the point where most patients, I'm just gonna be honest with you, a lot of patients, they just let themselves get really sick and then head to the hospital and be like, hey, you see this? This is my insurance being dick. And that's what they do. And that's what they do to get the medication that they need to get, because the only way they can get it is if they go to the hospital and they get severe enough that they need emergency attention, and that's the only place they'll get what they need to get because no one wants to give it to them normally. The healthcare system is so fucked. I've seen so much. You have no idea. It's absolutely disgusting. It's so bad. It's bad. It's pretty bad. I'm telling you. And honestly, I I could talk about this all day. I've experienced quite a bit of things. So I know too much shit. It's crazy. I just think it's really crazy how like some things they'll overcharge you and they'll charge so much money, but for other things that shouldn't be, it's like what the. Why is this price and why is that price and why is this is so necessary, but then this that's unnecessary. I don't what the. I don't know. Yeah, it's pretty complicated. And you know what? I don't get mad at people that work for insurance companies because they're just doing their job. Well, not like the work, like the customer service people. They're just trying to do their job like the rest of us. You know what I mean?